Hello everyone, my name is Michelle Danao, and today I'm going to show you how to insert a Foley catheter using this CAUTI insertion safety checklist. So what we need today is your Foley catheter insertion kit. You will need your clean gloves and your sterile gloves, and of course your hand sanitizer. So this is a checklist that needs two staff nurses, because I will be the one inserting and the other person or the other staff nurse will be observing me as I insert the catheter. So as you see in the checklist, you have to know the appropriate indication for the catheterization. So we have to know why we're doing it. Also, we have to verify the physician's order for the use of indwelling catheter, and we have to be able to explain the procedure to the patient once the patient gives the consent. Before anything else, we have to make sure we identify our patient using two identifiers. So using their name and birthday or their MR number, and verify it against what you have in here as a record. As you can see, I already fixed the curtains for privacy because we need that. And lastly, I will be performing my hand hygiene. And as I do that, I'll be calling my other staff nurse who will be helping me and who's gonna act as my observer as I insert my catheter. This is Nurse Nicole. All right.
Okay, so first step following performing hand hygiene is to don our clean gloves.
Okay.
We are now going to aseptically open our PeriCare kit.
And before I do that, I want to make sure I put my head, the head of the bed at my comfort level so it's easier for me to access. I think that's good enough. And normally I put the table on this side because I'm a right-handed person, but for purpose of documentation, it's going to be in this side.
In the catheter kits that you use in the hospital, you would be provided with the Castile soap wipes. So after you open the kit, you would complete PeriCare using provided Castile soap wipes. After that, you would remove your soiled gloves and you would perform your hand hygiene using your hand sanitizer provided. As you've seen, Michelle Danao has opened your CSR, your sterilization wrap, using aseptic technique.
So a lot of times that these sterile gloves do not fit the hands of the staff nurses. They normally bring another set of sterile gloves for them, which is easier for use. So I use my own sterile gloves. And then what's next on the checklist?
Once she puts on her sterile gloves, we will place the under pad beneath the patient. The shiny plastic looking side is positioned down closest to the bed.
Shiny part down. Okay.
After this, we are going to use the fenestrated drape, which has the window cut out in it, while maintaining aseptic technique. Now next, you're gonna notice that you have provided iodine wipes Some wipes will come with cotton where you have to pour the iodine on the cotton. The ones provided here have the 3 swabs.
Okay.
You're gonna make sure that they're saturated in the iodine. Next, you're gonna place them back down sterilely, and you are going to attach the water-filled syringe to the inflation port, being careful not to pre-test the balloon. After that is completed, you're gonna remove the catheter from the wrap and you're gonna lubricate the catheter.
Okay.
At this point, you can leave your catheter where you set it up on the table, or you can move it to the bed between the legs, whichever is your preference, as long as it's completed aseptically. Now we're going to prepare the patient with the foam swab saturation stick with provided iodine, using your non-dominant hand for the genitalia and your dominant hand for the swabs. You'll notice that Michelle is spreading the labia. From here, you're going to insert the catheter aseptically. Once you've inserted it correctly, you're going to inflate the catheter balloon with the entire amount of sterile water as indicated by the catheter package. Okay, as you can see, the catheter has been inserted. Now we're going to inflate the catheter balloon for the entire amount of sterile water as indicated by the catheter. The last parts include placing the securement device, positioning the hanger on the bed rail, as foot of bed, uses green sheeting clips to secure the drainage tube. You're going to then use your date, time, and initial label and secure that to the drainage bag. Reminder to make sure that you are connecting the catheter bag to a part of the bed that is non-movable. You've now completed your sterile catheter and you are going to document the procedure in the electronic health record.
All right, so thank you for taking the time watching this educational video using the 2-person insertion during Foley catheterization as you use your CAUTI insertion safety checklist. Thank you so much.